Hello, I just wanted to connect with you guys one more time before the papers. I've been meeting with a lot of students and answering lots of emails and some good questions. I'm finding a common theme coming up with just some of the challenges that students might be encountering. So, one thing I did want to really point out, if you did pick the topic of care of the elderly, a lot of students are looking to autonomy as that ethical issue. And so I just want to caution you against that one, in that, autonomy, if we look at the care of the elderly, specifically those with dementia, autonomy isn't really an issue. So if you look to this week's learning content and the PowerPoint that's been posted, we have what we call a substitute decision maker, and that's the kind of person that really helps to take place and to give back autonomy to individuals where their autonomy might be compromised. And so, in and of itself, when we think of dementia and the elderly, in an effort to overcome compromised autonomy, we've put a substitute decision maker in place. So a substitute decision maker has different roles and regulations that they need to follow, and one of those really is upholding that the values, beliefs, and decisions of the patient are made as they would impact that patient. So, they can't make decisions based on their own wants and desires. They need to make those that would be unique and that the person themselves would have made. So autonomy in and of itself, when we're thinking of care of the elderly, is not really an ethical issue. So I just want to push your thinking about that. And again, things like restraints in care of the elderly. If restraints are put in place and the policy and procedure in relation to best practice for a least restraints policy is used, this in and of itself is not an ethical dilemma because we have followed the guidelines in relation to that. Okay, so those two topics, as they relate to care of the elderly, really don't suffice for ethical dilemmas that would really contribute to a meaningful paper. The other thing, when you're thinking of care of the elderly, some of the topics that really jump out for me, are things like dignity and how the limited amount of time that's spent providing care, even personal care to the elderly, impacts things like dignity. How that links to things like justice or the issue of non-maleficence. So if you're going to take or choose that topic, moving more in those directions is going to really help you to have a really rich ethical dilemma in which to complete the paper. Okay. The other thing that I wanted to suggest is if, you chose a topic like Indigenous health. This is another really great topic for the paper, but you may want to narrow in on a specific aspect of Indigenous health. This might just actually help you to more clearly and accurately articulate the ethical issue that you see. So, for example, you might want to narrow it to the Indigenous access to healthcare services and the impact that has. Or you might want to look at an equal health status in terms of, we've looked at the statistics for the Indigenous population as compared to the rest of Canada. And the prevalence of chronic disease is significantly higher for that population. So you may want to narrow your topic down to help you really focus on pulling out an ethical issue. Okay. The other thing that I'm going to just suggest too, if you choose the opiate crisis, make sure you have a full understanding of what the opiate crisis is. So, it's the idea that we prescribe things like pain medications post-op, and that contributes to people developing an addiction later on, which then really leads to their reliance on those types of opiates and also other types of drugs. So we're really looking at, what are the ethical issues involved with that. So I just want to make sure that, when you pick your topic, that you are really making sure that you're looking at something that is indeed an ethical issue and not something that's linked to professional responsibility. And also that you are just sort of maybe narrowing your topic down to make sure that you are able to fully pull out the ethics of the situation. So I hope this just helps to provide a little bit more direction, and I look forward to reading the papers. Thanks.